Okay, got it. Okay.
So here's the thumb here.
Mm-hmm.
This is the trapezium. This is the bone that we're talking about. So normally this is the base of your thumb. This base is actually supposed to be all the way up here.
Right.
And so you have really bad arthritis here. And so if you had isolated arthritis to this joint, what we talk about doing is taking this entire bone out, the trapezium out. And then what we do is we suspend it. So we pull this metacarpal back up to where it belongs, which is, up a little bit here. And I suspend it using a a tendon that we take from the wrist here and swing it up to here,
right,
through a little hole in the bone. And that's called a trapeziectomy and an APL suspensionplasty. And APL stands for abductor pollicis longus. There's typically multiple slips of that tendon, and so we just use one slip of it. And we hold it into the second metacarpal, which kind of acts as like a, if you were like walking on a tightrope, that's what it acts as. Now, the issue with your hand is that your thumb MP joint, so the joint one above, when you hold your thumb up like this joint here has compensated for your bad arthritis by hyperextending.
Right.
And so, you narrow down here because of the arthritis, and then to compensate, because originally you can't grab anything like a cup anymore when it's like this, the next joint up hyperextends to compensate. And so when you look at your thumb, and you can see it in the x-ray here, so most people can only extend that joint to like neutral, like zero, like mine, right? This
right.
joint. Yours, based on my notes and looking at your, looking at my notes from you for last time and looking at you clinically, you were hyperextending about 70 degrees,
mm-hmm.
meaning, over halfway. Most people who hyperextend past 40 degrees, you actually have to do a procedure to that joint of the thumb as well. Otherwise, the thumb surgery would do you no good and it would fail.
Right.
And so what it is we actually fuse that joint. And so it involves putting a plate on that joint. Mm-hmm. So we basically prevent it by just fusing that joint. So it actually involved two of your joints. Okay. So it's a little bit bigger. It's a longer surgery, but the goal is to, get you a functional thumb again.
Wow. Okay. Yeah, it's gotten worse and it's getting worse. And
yeah.
Okay.
So that's the procedure. And the surgery, so like a normal trapeziectomy suspensionplasty takes about an hour and a half to do. Mm-hmm. If you add on the thumb fusion, it's about 2.5 hours. It's still a come and go procedure. You go home the same day. The post-op is the same. You're in a splint for 2 weeks, and then you're in basically like another cast or a splint for another 4 weeks afterwards. And then we start you on therapy at about 6 weeks.
Okay. And I guess there's, technology. I'm actually on the board of the Independent Living Resource Center, where we work with people with disabilities. Mm-hmm. And we actually might have some of this technology. We have a lending library. But it would be great to know, because like I said, I am a writer and I'm trying to complete a book about, what to do with a mouse and things like that. And the other thing is, getting a prescription for a home health nurse to help me. I've had that before, where they can come in and help us stuff, because it's getting to the point now where I'm pulling on socks, just doing basic anything that's like pulling on stockings, tights, anything. It's just getting really hard.
Okay. When are you thinking about wanting to do the surgery?
What's your recommendation in terms of when works best for you?
Well, so it doesn't look like I have any openings next week, but the following week we can do it. So if you want to do it quickly. So it looks like there's an opening on the 26th.
If I can get everything set up, so like what I need, because what do people usually do after?
Or there's also an opening on the 28th. So you mean like for the first 2 weeks?
Yeah, like how do they manage with having?
Yeah. So most people are like relaxed for at least a few days. I've had people go back to work like a couple days later. If they have like a desk job, some of them will do it, but it's honestly totally variable. I have some people who feel so much better because they had a lot of pain, so they feel better. I have people who hate me for 6 weeks because it's so painful, so it's a really like broad scale of recovery, which is really hard to tell you exactly how you do. But I do think that most people probably need at least kind of like a week to relax before you're kind of really functional again. I mean, you're up and walking the next day. We usually give you a numbing lock in the arm so that you have pain control for like the first 24, 48 hours.
Right. And then what do you use for pain after that?
So typically we give people prescription for oxycodone, Tylenol, and ibuprofen. And so it's a combination of those three.
I have to, because of my weight loss surgery, and I get really nauseated, I just have to keep all that stuff kind of
to a minimum.
Well, the ibuprofen.
Okay, ibuprofen at all or no?
I have when I've had dental surgery because that works better. And yeah, I just, the pain relief stuff, as long as I'm taking it with food, it seems okay. Like usually I'll just take nibbles on, you don't do a morphine type of thing or anything?
Well, we can, in specific situations. So what might be helpful for you is we can actually put in like an indwelling catheter for a couple days that anesthesia would put in at the time of surgery. So it would give you like better immediate kind of post-op pain control for a few days.
I've had, when I had my weight loss surgery, and I was on an IV drip of morphine, I actually had a really bad rash from morphine.
Okay.
I've had morphine in the past since then, like a shot where I've had a duodenal an intestinal sigmoid valvulus, and that was okay. But I think being on morphine drip, I do develop a rash. So if there's any alternative to that.
Okay. Yeah. So usually it's not a morphine. It's usually done. They do like a lidocaine or it might be like a ropivacaine they use.
Yeah. So if there is some kind of pain type stuff, because I have, some things I have a high pain threshold. Like I did labor, I was induced and I did that without any, pain stuff. But it's interesting. Some things I am and some things I'm not. But my hands, I'm really, anyway.
Okay. So what I'll do is I will put in an order for surgery, and then I put on the On-Q pump, which I think would be really helpful for you.
What is it called?
It's called an On-Q, like ONQ pump, which is like basically they give you a block at the time of surgery, which makes you nice and numb, but then they leave this tiny little catheter in that like releases. It's like a slow release of numbing stuff for like 48 to 72 hours.
Great, and then I can take something as needed. And then I watched some videos of you teaching, and you're amazing.
Oh, thanks.
It's pretty great, like how you taught about. You're just a really great teacher.
Oh, thank you.
Yeah, it was really wonderful. And Akazuki said great things about you. Oh, and matter of fact, his assistant worked with you and just raved about you. It's a guy.
Ryan. Is it Ryan?
I think so. Yeah, he's a sweetheart. Yeah,
he's very nice.
Yeah, he's really chill. So, anyways, okay. So about the home health, she's a Sutter home health nurse, and if there's a prescription or something like that.
Yeah, I just wrote a note to my scheduler to ask her about that and how we go ahead and do that. So if that'll once I put in your order for surgery, that'll go to her. Okay,
great. That's great. And all right. So, what are you better in the morning, or what's your ideal? And how long do you stay in the hospital? You go home the same day, or
you can go home the same day.
Holy shit! I mean, that's better for infection and stuff like that.
Yep. Yeah.
Yeah, I think before people who aren't vaccinated with the COVID stuff goes up, yeah, it'd be good to get it soon.
Yeah, so I'll go ahead and I'll put in the order now, and then I'll have Colette reach out to you, and we'll get you on the schedule for like not next week, but the following week.
When do you think I could be able to like hold weights again and wait? Like I do something called the bar method.
Oh yeah, I love bar method.
Yeah, me too. And it's been great we moved to home,
Yeah. I would say, so you want to wait at least 3 months in this surgery. So the recovery for thumb, we tell people it's a year-long recovery. But we don't start any strengthening until at least 3 months.
On that, but I'm sure, that would keep me from doing the surgery because I would, I'd go crazy.
You can do the rest of it. Like you're allowed to kind of, if you have the bar at home, you can like put that arm on something to do the squats. You can do all that stuff. I just don't want you to use that hand to do this,
Right. So you can't lift anything. What about, is there a way to do a plank? Like if you put your hand.
Yeah, you can still plank like this.
Right. Like
you just can't plank like this or like this.
Right. So you can't hold weights, but you might be able to wrap weights around your wrist?
Forearm, yeah, you could do that.
Okay, so there is some strength things.
Mm-hmm.
Yeah. Okay. All right. Okay,
that's not strengthening it like through the hand.
And so what do people do with mouse?
They either switch hands or they'll like use these fingers for it,
Okay. Is there a mouse you recommend? Like, can you send me some assistive technology recommendations?
Mm-hmm.
Yeah, anything that you know that people have found useful for all those kinds of things that I'm not even thinking of that I'd need.
Yep, will do.
That's great.
And so I'll have Colette reach out, and on your after visit summary, it'll say that stuff too.
Okay, that's fantastic. And let me think what else. Okay, yeah. So do you do morning surgeries or?
I do it all day.
Wow.
So, but all day means that here it ends by 5. So it probably would be like morning, like around 9 a.m. or something like that.
Wow. And, okay. Sorry. It's,
okay.
Yeah. I'll have to do a social media post.
There you go.
It's fun. Yeah. Yeah, eventually I think I'd need to do the other hand because that's starting, it's.
But I don't think your other hand, based on when I initially saw you, I don't think you have to do the fusion of the joint.
That means it's just like, but it's
the next joint up. We could just do the trapeziectomy.
Yeah, I've been getting I went to New York, and then I went to my son's graduation, and I had something that I pulled out. Anyway, I had the upshot is I had a Lyme's disease test, and it came back positive.
Yep.
But then we did the whole assay. Is that how you say it? And it came back negative. But there was something I pulled out that had a little bump, but I just started getting joint pain pretty bad in my left hand, which is something new. I don't know whether I should just take that as it was a negative and just, I didn't go on any antibiotics.
Usually when you do the assay, so I think the Lyme test is pretty non-specific. And so I think they do the assay frequently to say, oh, you know what, your original test was positive, but it's not.
Okay, yeah. Yeah, that's what I figured. Yeah, so I just have been getting joint pain, but that could just be arthritis stuff.
Yeah.
Okay. Okay, so I'll get the list from you. It'll be in my chart.
Yep.
The pains. What's the success rate? And what you take the tendon from?
The tendon is just part of the incision here.
And you take the tendon from?
That's where it comes from.
Oh, and
the APL, yeah.
Okay. And what are the risks?
There's a risk of infection, which is less than 1%. There's a risk of complications through anesthesia, but that's low and otherwise.
I've been fine.
Yeah. The other risks are there's a risk of bleeding, which is minimal. We use a tourniquet on the arm.
Oh, we should put in orders from, I have low vitamin K. I started getting injections of vitamin K. We should do a protein test and all of that just to see. I did get my levels up from like very low to with a vitamin K shot. So any protein, that test you should definitely order.
Okay. And then the other risk is that the thumb, even though we fuse it, it doesn't actually fuse. So it goes on to what we call a non-union. And so, but that's, low. So the success rate, the good to excellent results are quoted anywhere 85 to 90%.
That's pretty rad.
Yeah.
Yeah. Okay. And then physical therapy, when does that start?
Starts usually at about 6 weeks.
Okay. And that's after how long do you wear the cast for, and you have to shower with a thing on?
6 weeks, yeah.
Okay. And what do you do to, you use these fingers to pull things up?
Mm-hmm. So you'll have all of these fingers, just not the thumb.
Okay. That's hard though, but people.
Yeah.
And physical therapy, where do you go for that?
There's a bunch of hand therapists. Remind me, where do you live again?
Russian Hill.
So there's several hand therapists in the city. So we'll give you a list. There's one at St. Francis, which is probably the closest to you.
Oh yeah, they're pretty close.
Yeah.
Okay. And that's the time period I hate you. I remember you said there's a time period where I'll hate you. Or for a year I hate you.
It's honestly variable. So like some people feel great. I had a gentleman who had terrible arthritis who was wheelchair bound for other reasons. And like he came in at like, his 10-day visit was like, oh my God, I feel great. Do my other hand. And then I have people that come back at 3 months that are like, I'm still in pain. Like this is terrible. And then you see them again at 6 months and they're doing better. So it's very variable. But I tell everybody it's a year long.
I tend to, like, with the weight loss surgery that had a high, I tend to do really well. And maybe my optimism helps with the,
I think so.
Okay.
And so I'll send everything to my schedulers and then we'll give you a call.
All right, that's awesome. Do you ever video like your surgeries and stuff like that?
I don't.
Okay.
But I can, if you remind me on the day, we can take a picture of what the arthritis looks like when we get in there for you.
Okay, that's great. And if you do want to see the documentary about me,
oh yeah,
it's called Author. It's Amazon, Vice, and A&E. It's called Author: The J.T. Leroy Story. It's on Amazon Prime for free.
Okay.
And that one, I had no say in what they did, but I gave them all my archive. Then there's a movie where Laura Dern played me and Kristen Stewart played my creation, but it's bad, and I had nothing to do with that. It was like, once you in the U.S., when you're a public figure, you have less rights than in France. I would be protected, but they made the story. I was working on a TV series about it, but the studio that was doing it was Rat Pack, and he was involved in Me Too, and he got canceled. And I won't say that it wasn't very well deserved. But anyway.
Okay, well, that's great to know.
I'm a writer.
Yeah, that's fun.
Yeah, kinda, not really, but it's an interesting story. But it's, how many often do they make stories about, doctors or writers? It's usually you've either done something really bad or really good or somewhere in between, and it needs to be explained. Let me think what else I have of questions. Okay, yeah, I guess my big thing is just having enough pain coverage. It's the idea of being in pain and not having, because I know what that's like. So if we're not going to do the morphine thing, what's the other option?
It is, so it's oxycodone and Tylenol and ibuprofen if you can take it.
They don't have any other kind of, there's no alternative that they have for morphine?
But it's not morphine, it's oxycodone.
But you were talking about morphine thing before. They don't.
No, I was talking about the On-Q pump, which has it's like a lidocaine that's in it. That's not morphine.
Oh, okay. Got it. All right.
Yeah.
Got it. Okay. All right. And that usually works for people?
Yeah.
Okay, great.
And you'll talk to the anesthesiologist about that on the morning of, but I put that in the order too.
Okay, great. All right. And then, yeah, so there'll be everything about what I need to set up with my house and everything.
Yep.
Okay.
There's not much setup. I mean, it's just a splint on the right side. So there, in terms of like setup, you don't really need anything else because you still have your left hand and your right fingers to assist you. So there really isn't any like other modification.
Okay. I might just need, so I'll ask you for that referral for the nurse. And
Yep.
Are there bandage changes? Stuff like that?
Nope, we do them here.
That's cool. I had drains in when I had because I was morbidly obese and I had skin removed and
Yeah. No, none of that. So this is a much smaller surgery.
yeah, I'm just showing off. I'm just flossing here. I had drains. Okay, well, okay. I guess it's just intense. So I'm just
Yeah.
Well, thank you for your time and everything.
Oh, sure,
And,
sure. No problem. And we'll get you on the schedule, and then I will get Colette to reach out to you.
Okay, great.
All right.
And if I need, you'll be through My Health, so if I need.
Absolutely.
Okay, great. I have a in-home health. You guys should know. I think I told you. I have it's brachytachycardia. I have a
Brachytachycardia. Yeah.
Yeah. My pulse can go really low, so that could scare the shit out of people. So I have an in-home health care worker who helps me. So I might ask for more hours if I have medication. My pulse gets really.
Okay.
Yeah, so I might need that, especially if I'm on.
Okay.
Okay, go.
All right.
Thank you. Have a wonderful day. And
thanks, you too.
I would love to. I think maybe surgery in the morning would be.
Okay. I'll let everybody know.
All right. Bye. Thank you. See ya.
Sure. Take care.
Bye.